Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 10 of my multi-part video series of doing so. Today, we will be taking a look at neutropenia conditions. Without any further delay, let's go ahead and get started on today's content. Let's start off by talking about some important information in regards to neutropenia conditions. Neutropenia can manifest as oral ulcers, fever, and sore throat, a crucial point for NBME or USMLE exams. Clinical scenarios may involve a child undergoing chemotherapy for acute myeloid leukemia, also known as AML, presenting with mouth ulcers or a sore throat. Let's now take a look at neutropenic fever, also known as febrile neutropenia. It is a type of neutropenia accompanied by fever. Can arise in patients with chemotherapy or radiotherapy-induced pancytopenia or viral-induced neutropenia, for example, parvovirus B19. Considered a medical emergency due to compromised infection-fighting ability. Initial management on NBME and USMLE exams typically involves intravenous broad-spectrum antibiotics, followed by granulocyte colony stimulating factor, GCSF. Let's next look at viral-induced neutropenia. Parvovirus B19 infection can lead to viral-induced neutropenia by affecting myeloid precursors. Other viruses may induce antibody formation against neutrophils, analogous to immune thrombocytopenic purpura, also known as ITP, with platelets. Let's next look at cyclic neutropenia. It is associated with gene mutation-associated episodes of fever and mouth ulcers typically observed in children aged 1 to 3. Episodes often recur every 21 days, although specifics may not always be provided in questions. Alright guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 7-year-old boy with a history of acute myeloid leukemia, AML, presents to the clinic with complaints of mouth ulcers and a sore throat. He's currently undergoing chemotherapy. Which of the following best describes the association between his symptoms and his medical condition? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Neutropenia can present with mouth ulcers, fever, and sore throat, particularly in patients undergoing chemotherapy. This presentation is consistent with the patient's history of AML and ongoing chemotherapy, indicating neutropenia as the likely cause of his symptoms. Therefore, the correct answer is A. Neutropenia often presents with mouth ulcers and fever, especially in patients undergoing chemotherapy. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B is incorrect because mouth ulcers and sore throat are actually common manifestations of neutropenia, especially in the context of chemotherapy. C is incorrect because while viral infections can cause similar symptoms, the patient's medical history of AML and ongoing chemotherapy make neutropenia a more likely explanation. D is incorrect because mouth ulcers and sore throat are indeed common in patients with neutropenia, especially during chemotherapy. E is incorrect because while fever is a common presentation of neutropenia, mouth ulcers and sore throat can also occur, particularly in the context of chemotherapy. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old woman with a history of breast cancer presents to the emergency department with a fever of 39 degrees Celsius, or 102.2 degrees Fahrenheit. She recently completed a course of chemotherapy. Laboratory tests reveal low neutrophil count. What is the most appropriate next step in management? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The patient's clinical presentation with fever and neutropenia after chemotherapy is consistent with febrile neutropenia, a medical emergency. The next best step in management, as recommended by NBME and USMLE exam standards, is to promptly initiate treatment with intravenous broad-spectrum antibiotics to prevent severe infection and sepsis. Therefore, the correct answer is B. Begin treatment with intravenous broad-spectrum antibiotics. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A is incorrect because observation without antibiotic therapy is not recommended in febrile neutropenia due to the high risk of serious infection. C is incorrect because granulocyte transfusion is not typically indicated in the initial management of febrile neutropenia. D is incorrect because delaying treatment until blood culture results are available can lead to significant morbidity and mortality in patients with febrile neutropenia. E is incorrect because while investigating viral causes of neutropenia may be important in some cases, immediate antibiotic therapy is crucial in the management of febrile neutropenia to prevent severe bacterial infections. All right, now that we have covered this question, let's move on to look at the next question. A 25-year-old woman presents to her primary care physician with complaints of fatigue, sore throat, and recurrent oral ulcers. She reports recent exposure to a friend with a viral illness. Physical examination reveals mild pharyngeal erythema and multiple oral ulcers. Laboratory tests show a decreased neutrophil count. Which of the following viruses is most likely responsible for the patient's neutropenia? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Parvovirus B19. Infection can lead to viral-induced neutropenia by affecting myeloid precursors. The patient's symptoms of fatigue, sore throat, oral ulcers, and decreased neutrophil count are consistent with this viral etiology, especially given recent exposure to a friend with a viral illness. Therefore, the correct answer is C, parvovirus B19. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A is incorrect because while influenza virus can cause systemic symptoms, it is not typically associated with neutropenia. B is incorrect because EBV infection is more commonly associated with infectious mononucleosis and lymphocytosis rather than neutropenia. D is incorrect because RSV primarily affects the respiratory system and is not known to cause neutropenia. E is incorrect because while CMV can cause various systemic manifestations, neutropenia is not a typical feature of CMV infection. All right, now that we have covered this question, let's move on to look at the next question. A 2-year-old child presents to the pediatrician with a history of recurrent episodes of fever and mouth ulcers every 3 weeks. The child appears otherwise healthy between episodes. Which of the following genetic mutations is most likely responsible for the patient's cyclic presentation of symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Cyclic neutropenia is typically caused by a mutation in the ELANE gene, resulting in episodic decreases in neutrophil count and subsequent symptoms of fever and mouth ulcers. The characteristic recurrence of symptoms every 3 weeks corresponds to the cyclic nature of neutropenia associated with ELANE gene mutations. Therefore, the correct answer is C, mutation in the ELANE gene. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A is incorrect because mutations in the FANC gene are associated with Fanconi anemia, a condition characterized by bone marrow failure and cytopenias, but not cyclic neutropenia. B is incorrect because mutations in the TP53 gene are associated with Li-Fraumeni syndrome, a cancer predisposition syndrome, and are not typically associated with cyclic neutropenia. D is incorrect because mutations in the G6PD gene are associated with glucose 6-phosphate dehydrogenase deficiency, a condition primarily affecting red blood cells rather than neutrophils. E is incorrect because mutations in the WAS gene are associated with Wiskott-Aldrich syndrome, a rare immunodeficiency disorder characterized by eczema, thrombocytopenia, and recurrent infections, but not cyclic neutropenia. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.